We are 1039 WDKX, Rochester's #1 station for R&B, hip hop, and throwbacks. Joining us on this Wednesday morning, Dr. Janice Harbin from Jordan Health. Good morning, Dr. Harbin. How are you?
Good morning. I'm well. Happy holidays. The holidays have begun, so happy holidays.
Yep, we are in full swing. And with that comes the alarming numbers we've been seeing with COVID-19 the last couple of days. I think it was over 800, reported yesterday. 1,500 before that. I mean, this is a number that isn't going down. You're having more and more people that are getting vaccinated, young people now vaccinated. The booster shot is available. So what do you think, Dr. Harbin, with all of these numbers now going up in between the holidays of Thanksgiving, Christmas, Hanukkah, and all the other different events taking place?
Well, it's alarming. We're going back to the days when we were at the peak of COVID. It is alarming. We feel, I know people are tired. I'm tired. We have to remember that COVID is not going on vacation. It is here. It's our reality. And we still have to do what we need to do to prevent as many things as we can prevent. So we need to get vaccinated. I'm still alarmed how many people I interact with that I'm still asking them, how come you haven't gotten vaccinated? And I don't know what they're waiting for, but they're still waiting. And we've gotten comfortable, so we're taking off our masks when we still need to have those masks on. We still need to practice the safety that they told us even in 2020. We're going into 2022, and things are not getting better. And we don't want to shut down. I don't want to shut down. So we need to do our part.
When it comes to the vaccinations, I know there was a bit of a time frame that goes for people who have been vaccinated. So what happens if you've gotten vaccinated over 6 months ago? Are you still protected from the COVID-19 symptoms, or do you have to get the booster now?
Well, keep in mind they're recommending that you had the Pfizer or Moderna. That's the 6 months. So if it's been 6 months, they're recommending that you do get the booster. And the reality is they're still figuring this out. We may be needing boosters every 6 months or once a year. Most of us get the flu vaccination once a year because they know that the next year I'm not as protected as I was. It's probably going to be the same thing with this COVID. So if it's Pfizer, Moderna, after 6 months, you need to get a booster. We recommend a booster. If it's Johnson & Johnson, that was the one shot, they're saying after 2 months, you're eligible for a booster. And why not protect yourself?
Now, if you need to make an appointment for COVID-19 vaccine, if you thought about it and want to know where to go, Jordan Health is a place you can go. You need to call to make an appointment. Now, this is if you want the vaccine. It's 585-423-5831. That's if you want the vaccine, 423-5831. If you want to get tested, which we'll talk about in a minute, you can also go to Jordan Health, 423-5848, 423-5848. I know the county just started to let people know that they are getting rapid testing, that they purchased some of those. Your thoughts on the rapid testing, or would you go to a healthcare facility to get tested, or it doesn't matter?
Well, I would say that I did hear that I saw County Executive Bello on TV announcing, I think it's 750,000 tests have came into Monroe County. 250,000 of that is for young people, for the kids, for 500,000. I would say that is an avenue. So get tested, because what you find is you may have a false negative, but you don't have a false positive. So at least with the test, it's kind of saying if it's positive, that's an indication, okay, don't go out and act like everything's okay. Go to your doctor, come to Jordan. We have a vaccination and testing center we opened up last year, and we're keeping it open 5 days a week because we know that this is not going away. Follow up, and then, you could get the nasopharyngeal test to kind of look at it a little deeper. But I would say that's a good thing. It's at least we're finding that you're not finding false positives. So if they say that you're positive, you're probably positive. And you could follow up and not go about your business as if everything's normal.
Dr. Janice Harper joins us now from Jordan Health. If you have any questions or concerns, always, Jordan Health is there within the community, a trusted place for you to go if you have any questions going forward. I know a lot of people are concerned about it. You also have a number of people, Dr. Harper, let's be real, that have caught COVID multiple times. Like, it's not just once, they've caught it multiple times. I know a few people that have lost the sense of smell, the sense of taste. I've seen some people come back and they're fine. Some people with health concerns following getting COVID, still not 100% yet. So this attacks different people different ways, right?
It does. And, there are people that had COVID that are still having problems. They're having problems with shaking, again, with their taste, their smell. They're having health problems. So it's not as if that it impacts you differently. And you can't take for granted, well, I'm healthy or I'm healthy enough, and if you get it, you really don't know. Some of these symptoms are young people. Thank goodness for some of the older folks like myself. We got the vaccination early. When they said we could get the booster, we got the booster because you don't know how it's going to impact you. So I would say the best thing to do is prevention as much as you can. We do know that there's breakthrough, so you could be vaccinated, you can have a breakthrough. But what they found is you will not get as sick. You might feel like you have a cold or a slight flu for a day or two, but you don't get as sick. You shouldn't end up in the hospital. So you're still protected against having really severe symptoms or ending up in the hospital or, worse yet, dying from the COVID.
Dr. Janice Harbin every Wednesday morning talks to us about this very issue. If you have any questions, concern, I would always recommend going to Jordan Health service within this community, and don't feel judged. They will go in and help you if you need their help, but you got to walk through the door to ask for it. So if you need any advice or want to know what to do when it comes to your health, your child's health, or any other services that Jordan Health provides, I would suggest you stop by. Thank you, Dr. Harbin. Appreciate it.
Thank you, and thank WDKX for being community leaders in all health issues, but resource for this community. So thank you.
Yeah, we got to know. So keep us around. We are WDKX. Good morning.